Now with our GMA cover story, it is October 1st, the first day of Breast Cancer Awareness Month. And this year we are celebrating 40 years of pink when the American Cancer Society launched this mission to bring attention to breast cancer.
Hard to believe it has been 40 years of doing this. There has been life-changing and life-saving progress from diagnoses to screening to treatment to access to care. Dr. Alpa Patel of the American Cancer Society is here with the latest in the fight. Good morning to you, Dr. Patel.
Good morning.
Always
Thank you for having me.
Thank you for coming in. What are the biggest changes you've seen in outcomes over the last 40 years? Where's the progress now?
There's so much to celebrate around breast cancer and the progress that we've made in the last 40 years. You can sum it up with, I think, one statistic, and that is that we've seen a 42% decrease in the breast cancer death rate over that time, which means more women are surviving than ever before. What's exciting to me, though, is that that progress is not just in one specific area. We know so much more about the risk factors for breast cancer so that we can prevent them better. We know how to get women to get screened, and we're improving the technologies around screening. And we have so much more to offer in terms of treatment, including for metastatic breast cancer.
And we know that young women, particularly women of color, are facing breast cancer diagnosis more often, which is your area of specialty. Why are these disparities happening, and what's being done to close that gap?
This is a really alarming trend and one that we need to figure out quickly. We're seeing that there is an increase in breast cancer among women, particularly under the age of 50. And we have to understand why that's happening. The most alarming part of these trends are the disparity between black women and white women. So black women are actually less likely to hear the words "you have breast cancer," but more likely to die if diagnosed. And we know that we have to do those things that we already have in place, which is ensure access to high quality screening and access to cutting edge treatments. But we also have a lot that we have left to learn. And that's why I'm so excited that last year we launched a new initiative partnering with 100,000 black women across the country called Voices of Black Women, so that we can understand so much more about why that exists and work towards eliminating it.
I have to understand it, because I'll never forget at the age of 46 being diagnosed with breast cancer and saying, as a black woman, you're less likely to get it, but more likely to die if you get it. And so you hear those words, you're like, what do you possibly do with that? Also, there's been a lot of discussion about the new guidelines when it comes to dense breasts. Just explain a little bit more about what dense breasts are and those new guidelines.
Yeah, so many women, about 40% of us have dense breasts, but so many women don't know what that means. So there's different types of breast tissue and fatty tissue in your breasts. If you have a higher proportion of breast tissue, that's going to make your breast more dense. And that actually shows up, and you can calculate breast density by getting a mammogram. And as of last year, it's now required to be reported in your mammogram report. So please pay attention to that report. Most of us are looking for those words, no evidence of cancer detected, but we don't read the rest. Read the rest, because your density is reported there. And then based on that score, talk to your doctor, because we know that it puts you at higher risk of developing breast cancer, but it also makes it harder to pick up a cancer in the mammogram. So think about trying to spot a polar bear in a blizzard versus on a bright blue sunny day. It's a lot harder to find that. So you may need to get screened using a different technique, or you may need to be screened more frequently. So it's important to have that conversation.
That's a big highlight, I guess, to talk about today. But also, I keep seeing exciting things like vaccines and maybe using AI to maybe find that dense, through that. How does that work?
So we're actually doing some really interesting work ourselves, where we're just imagine taking that facial recognition technology and applying that to deeper learning on a mammogram or on a tumor slide. There's so much exciting work that can happen with AI. And vaccines as well. There's a lot of promising early studies underway. We already know that vaccines are effective in treating other types of cancer. We're seeing them used for bladder cancer, prostate cancer, and melanoma. So over the next few years, I expect that we'll see a lot more coming out in this space.
Thank you for coming in.
And
Yeah.
can we just, because we have both been impacted, our brothers,
Yeah.
breast cancer. I know we always talk about
Yes.
women, and they are the vast majority. We are the vast majority that are affected by that, but we should also give a nod to the men.
Absolutely.
Yes.
Absolutely. Men, make sure that you are aware that you too can get breast cancer and to be aware of
Good.
those risk factors.
I appreciate that.
Dr. Patel, thank you so
Thank you
much
for
for all your
having me.
information. Really appreciate you. Thank you. And on Friday, we will have a panel of experts and survivors with more on Breast Cancer Awareness Month.